Richards. I am a child and adolescent psychiatrist and an employee at staff psychiatrist at Cherry Hospital in Goldsboro, North Carolina. Thank you for participating in our webinar today, presented by North Carolina Voluntary Organizations Active in Disaster, entitled North Carolina and COVID-19, Perspectives and Community Resources for Children and Families. I'd like you to take a moment and familiarize yourself with WebEx and the controls. And I'd like to take a moment and ask the panelists to introduce themselves.
Good morning. My name is Tracy Brenneman, and I'm the District Administrator for Judicial District 3B for the North Carolina Guardian Ad Litem program. Thank you for having me.
Good morning. This is Cynthia Floyd. I'm the State Consultant for School Counseling with the State Department of Public Instruction, and glad to be with y'all today.
This is Heather McAllister. I am the Children's Health and Development Coordinator at the North Carolina Division of Social Services Child Welfare Section.
Hi, this is Cassandra Rowe. I also go by Cassie. My pronouns are she, her, hers, and I am the Healthcare Program Coordinator at the North Carolina Coalition Against Domestic Violence. Pleased to be here.
And Anne?
And Anne is now unmuted. Anne?
Ann Huffman. I'm the president of North Carolina BOAD, leader of the Child Wellbeing Task Force. I would like to give you just a short introduction to BOAD if you're not accustomed to that. North Carolina BOAD is a group of all organizations who are interested in participating after disasters, who use volunteers in their work. We liaise with the state emergency management and with FEMA to respond to disasters. And I thank you all for attending this webinar. And I thank our attendees and our presenters.
All right, so let's begin. Panelists, you have a vast experience in working with various community agencies and support services. Could you tell us a little bit about what you've seen during this time of COVID, your professional perspectives on how the lives of families and children have been affected by the COVID-19 pandemic?
Certainly, this is Tracy Brenneman with the Guardian Ad Litem program. Certainly, life is tough for families on any given day, but 2020 certainly has brought more challenges than we've ever seen before. Families are truly under an extreme amount of stress related to COVID-19. There's, certainly the disease itself is quite frightening, and we have various information out there about the disease. So as a parent, it's very stressful to know what's the best thing to do in terms of education and just basically being out in the community. And a lot of our families have suffered economic impacts due to changes in their employment, whether from being laid off or, having to work in scary conditions. So certainly, how that affects families causes concern for those of us who work in child welfare, because we do know that when families are under stress, then children can suffer neglect and abuse, even though we do believe that families do the best that they can. Children are currently isolated a lot because of the quarantine, so they aren't interacting with teachers and others folks that they normally do on any given day. And we rely very heavily on those folks that these children see from day to day as being the ones who provide reports to Department of Social Services to let us know if they have concerns about children in the community. And we are concerned that as children start back to school, back to daycare, and as some of those measures are relaxed, that it is likely there will be an increase in reports and the number of children entering foster care. And in fact, we've already begun to see that.
Heather, would you share a little bit about your perspective?
Sure. So from the child welfare perspective, Division of Social Services, COVID-19 has really required the division and the local departments of social services to do a tremendous amount of work on how are we going to continue to perform this essential function during times of COVID. This is unlike any other disaster response that the state has had to engage in due to the pandemic. It is rather than affecting a single area, it's a statewide and entire country is being affected by it. We have seen a reduction in the amount of reports of abuse and neglect, which is concerning. And really, a lot, we rely on our community partners, adults, caring adults and others in the community who are really, they see the children regularly in school and in other settings and report if they suspect abuse and neglect, they will report it to their social services. But child welfare in itself, it's a very it's a face-to-face intervention in most circumstances. When we get reports, we have to go out into the community, and a lot of changes had to be made in a very short amount of time to make sure that not only the child welfare social workers were safe, but the children and families that they serve as well. Utilizing personal protective equipment, having to have guidance on our visitation practices. Many visits when children are in foster care, they have often, in most cases, court-ordered visitation with their parents, and having to develop guidance on how to allow that to continue safely. And really working, encouraging our local DSSs to take cases as a case by case. There's a tremendous impact on children from a trauma perspective of not being able to engage in those regular activities, and also not being able to see their families if there were concerns around spread or contagion. And then just developing all of the different things to try to keep people safe from COVID, anything from transportation to buildings and visitation rooms, and how do you manage all of that? And again, a short amount of notice. And then guidance on the use of accessing telehealth, and that would be telebehavioral health services, and then ensuring that children in foster care continue to have the health care that they need. Initially, many pediatric practices were not open, and then when they were, encouraging people because of the fear of going into the community, and particularly going into medical places where there may be other people who are sick or not feeling well, but making sure that children and youth in foster care receive their required physical health care and immunizations. And then lastly, continuing to train foster parents. That's another activity that was, a face-to-face activity that the local DSSs and private licensing agencies regularly, did outreach and trained people who were interested in becoming foster parents. We had to move all of that training online to allow for the continued, to allow these parents to be trained. And lastly, one of the recognition from Governor Cooper and our our secretary, Dr. Manny Cohen, we were child welfare workers in June 8th were designated as first responders. And that is tremendous, tremendous designation, and also impacted our ability to access different resources such as PPE that we would need.
Thank you, Heather. Cassandra, would you share some of your perspectives?
Sure. Hi again, everyone. So again, I work at the North Carolina Coalition Against Domestic Violence, and just a little bit about our organization. We are a statewide coalition, and we support the the local domestic violence agencies in each county by providing training and technical assistance. We also do statewide prevention work and policy development, as well as legal advocacy. And we know that domestic violence has a huge impact on health in general. Survivors are at great risk of experiencing adverse physical, sexual, and reproductive health impacts, as well as mental health impacts. And folks who experience domestic violence are at a higher risk of experiencing homelessness. And so there is already this connection between violence, adverse health impacts, homelessness, poverty, etc. But COVID-19 has really exacerbated this. So as many folks are experiencing unemployment or underemployment during the pandemic, there is an increased risk of homelessness and loss of healthcare for survivors, and an increased economic dependence on abusive partners. So we see even during normal times, there are many barriers for survivors to access services and also to leaving abusive partners. And a huge part of that is economic dependence on partners, and that is even more so the case now during this pandemic as people are out of work or underemployed. And also the safer at home approach, while many people are no longer, necessarily staying at home all the time, most folks are at home much more of the time than they were before the pandemic. And so while that does keep the majority of people safer from contracting COVID-19, it does put people who are experiencing domestic violence at increased risk of experiencing more frequent acts of violence and more severe acts of violence, because they are just around an abusive partner more of the time. There's also increased stress in homes that can lead to increased violence. So this loss of income or working in high-risk jobs, as well as a lack of childcare and remote learning, and how stressful that is on families, can increase the amount of domestic violence that is happening. Children are more likely to witness domestic violence during this time because everyone is at home and children are doing remote learning. Isolation is something that we see, again, generally for survivors of domestic violence. Abusive partners often use isolation as a tactic of control. So, limiting the amount of contact that they have with their friends and family. But that is even more so the case now because we are necessarily limited from our social networks and support due to the pandemic. We also have an overwhelmed safety net at the moment. So as so many more people are requesting assistance, financial assistance or housing assistance, the folks, survivors are, looking for the same types of assistance and may not be able to, or may be coming up against, taking a really long time to be able to access unemployment benefits or access services from those that they might normally be able to. So that's just a little bit about how COVID-19 is impacting survivors of domestic violence.
Thank you, Cassie. Cynthia, would you please share the school perspective?
Sure, thank you. And thank you to my colleagues. As you all heard, COVID-19 has presented a lot of stressors that even we as adults are having significant difficulty coping with. And when you think about children, they have fewer coping skills than we do, and they're facing these same stressors. As we think about children getting ready to return to school, whether it be remotely or a hybrid version of remote and in person, we're hearing more and more talk about doing it remotely. That's still an added stressor. We expect to see some potential emotional behaviors and things like that that would be red flags, but that is usual for the beginning of a school year. A lot of kids get nervous about the beginning of the school year. It's completely normal to see some of that behavior. But with the added stressors that we're seeing now, it's going to be more important than ever for we as a North Carolina community to be more vigilant in supporting the emotional well-being of children and recognizing when it graduates from a usual stressful behavior that subsides to something that's escalating and might need more support. So when we think about this, again, it's not uncommon for children to be stressed, and you see some of these behaviors for the return to school year. But this year, be more cognizant of emotional behaviors like being extremely sad for extended amounts of time, being more fearful than normal, difficulty rebounding from usual setbacks, or having a worried or negative attitude. And as far as social behavior, you're seeing more so than usual that they're withdrawn and argumentative or uncooperative, having temper tantrums, outbursts, things like that. Academically, it's going to be a very difficult year again, just as we ended this past school year, trying to adjust almost overnight to a different way of doing education. Educators are working tirelessly to try to make this as easy as possible for students and for families, but you're still going to see some struggles with academic behavior. If you're seeing persistently that there's a complete lack of interest in academic topics, or they're not doing acceptable work, or unusual difficulty concentrating more so than you would expect even under these circumstances, or just completely disengaged, it might be some red flags to continue to watch that to see if it's being more persistent. Sometimes these emotional concerns and stressors show up as physical symptoms. So if a child is continuously having headaches and they don't have a history of that, or upset stomach, complaining of dizziness, even shortness of breath or muscle tension or trembling, even if it gets severe enough. Again, if this is like a one-time occurrence, it's probably typical stress. But if you see this being recurrent in children, they're having a much more difficult time handling the stressors that are coming at them in relation to our current situation with COVID-19 and other things. So the more that we can establish social emotional support from the beginning, the more we can have the opportunity and capacity to prevent these emotional needs from escalating. Research has told us that any caring adult who can establish a safe, stable, nurturing relationship with a child can be a significant buffer against the effects of toxic stress, also known as adverse childhood experiences, which COVID-19 has the potential to be an ACE, or adverse childhood experience. So you as a parent, or you as a community member, or teachers, any of us can be that caring adult that helps buffer children from the negative impact of adverse childhood experiences such as COVID-19. The research has told us that having that relationship is more impactful than the adverse childhood experiences itself. So we're really hoping to see more people trying to mentor children positively. Teachers are preparing to address the social emotional needs first before they think about the academic needs. If you look at our state guidance lighting our way forward, there's a whole section on supporting social emotional needs of children. So if you see these emotional concerns continue to escalate, you might want to consider, or the teacher may want to consider, referring to school counselors or other specialized instructional support, such as school social workers and the like. Typically, what you'll see is schools will have some kind of process in place. So you can check with your child's school for how to access available student services, such as school counselors, school social workers, school psychologists, and school nurses when needed. And they can often connect parents to community resources as well. In most schools, you'll see parents either asking the teacher, how do I connect with the school counselor? Or they might reach out directly to the school counselor. You can check with your school to see what that process might be. So the emotional concerns we mentioned previously, if you see those being persistent and escalating, that's when you might want to refer to the school counselor. Or if the needs start getting greater than what the teacher feels like they can provide through their differentiated support in the classroom, whether face-to-face or virtual, they might reach out to the school counselor. Additionally, the school social worker You or the school counselor or the teacher can reach out to the school social worker, who often helps with, like, if a student makes no appearance at the beginning of the school year, whether virtually or in person, the school social worker is going to follow up on that and make sure the child's okay and see if the family needs additional resources. If you're having trouble with accessing resources, a school social worker can help connect you with where to find those. School nurse, we mentioned a moment ago some of the physical signs that you sometimes see with children who are having a hard time coping with stressors. And the school nurse can help with that. They can also help with, some of the things that we mentioned before with economic hardship. Some people are having trouble meeting the medical needs of their children, and the school nurse can help, and the school social worker can help connect people with those as well. Typically, the school psychologist, the referrals will typically go through a school-based team for that. But if you feel like you have a need that the school psychologist could just ask your school. They typically work with assessing of needs of students, but the school is there, whether you're showing up at a brick and mortar building or not. School personnel are there to support students and their families. What you see on that slide is kind of a spectrum of our emotional health, and same with physical health. We try to maintain health. We're teaching kids, cover your face when you cough or sneeze, to maintain physical health. And we need to do the same with emotional health. We need to teach them how to maintain that emotional health and get them connected to the appropriate services if that emotional well-being and distress grows. If it grows beyond the capacity of school personnel, so which is you would see in this orange and red spectrum, then the school personnel can help connect you with community resources that are also providing social, emotional, and mental health services. So be sure to reach out to your schools if you need some additional help with some of the stressors that students are facing and our children are facing in our communities.
Thank you, Cindy. This is Jennifer Ritz speaking, your moderator. And for attendees, I'd like to encourage you, if you have questions that arise at the end, we'll have an opportunity for a question and answer session. Please use the chat function to begin letting us know about some of the questions that you'd like to have answered later on in our program. Panelists, you have a wealth of information as well as resources that you're familiar with. Please tell us about some of the resources that you're familiar with that can be available to our families and children and communities. And Tracy, would you start with telling us about the Guardian Ad Litem program?
Sure. Our program is one that recruits, trains, and supports volunteers who become the voice of a child in court. So whenever DSS files a petition alleging that a child has been abused and neglected, one of our volunteers is appointed as the guardian ad litem for that child. And what they do is they complete an independent investigation of the child's situation, and then they make recommendations to the court about what they believe is in the child's best interest in terms of their permanence and their well-being. So the any caring adult that my partner just talked about is what our volunteers try to be. Is they try to be that person who is there with that child while they're in foster care and speak up for them and what their needs are. And it truly can make a difference, not only for the person volunteering, because our folks find it to be very, very rewarding, but also for our community, because children who age out of foster care without a caring adult, without a good permanent plan, often, wind up homeless. They can wind up in trouble with the law. They can become parents too early before they're ready. And those things, impact our entire community when our children don't have good outcomes. So becoming a volunteer guardian ad litem is very important. And I think towards the end of our presentation, there'll be some contact information. So if you're interested in volunteering, you can reach out and we can give you more information about that. And certainly just offering support, to the families in the community is important. It's tough because we are isolated now, but if you are having contact with children and families and see concerns, I hope that you'll take down some of the information that you see today and share that either through social media or however you can with families, because it's tough being a family, period, much less during the time of COVID. And if there are those situations that do cause you to suspect that children are being abused or neglected, we do have a law in North Carolina that requires that anyone who does suspect that a juvenile is being abused, neglected, or dependent, that they are required to make a report to your local Department of Social Services. Often, I know for a lot of people that sounds punitive. However, the Department of Social Services will only get involved if the information reported meets that legal definition of abuse or neglect. And when they get involved, they do their best to help the family mitigate those concerns so that hopefully those kids don't ever actually come into foster care. So it's really important that we become diligent as a community to look out for those in our community who are more vulnerable, um, certainly the children and the elderly in our community.
Thank you, Tracy. Heather, would you like to tell us about some resources that you're familiar with?
Sure. And Tracy is absolutely correct that child welfare in and of itself is a resource for families, and can, if involved, if necessary and involved, can not only provide case management for families, that they can connect them to a lot of necessary services to help address whatever need it was that brought the children to the attention of social services. So we have, we're flipping through here, different resources available from your local departments of social services. There's food and nutrition services, often referred to as food stamps. Those are benefits, those are income eligible benefits. There's as well as Work First, which is another income eligible benefit for families who may meet the different requirements for their programs. Medicaid, again, it was mentioned earlier, many families are losing their health insurance, and really important to be able to have a resource to support getting any kind of health care or behavioral health care needed. We know the stress is impacting children, youth, and their parents. And there may be that Medicaid may be able to provide that the insurance needed to get the necessary treatments. We also have, we put out the pandemic, it's called the PEBT, but it's a pandemic electronic benefit to help with food resources during COVID. We support and promote for parents who might be struggling with managing their children's behaviors, or just want to learn more about increasing their parenting skills. We have online, we have what's called the Triple P program online, and it's available to all North Carolinians. It's basically simple and practical strategies to help them manage their behavior. And so, the links to get to access that are on the slides, and people may be interested in learning more about that. We also are, if folks are looking, I know that we have touched a little bit on behavioral health care, but there are the resources available to train people in the local community to learn more about recognizing the signs of behavior. A person may need some support with their behavior or their mental health, and that would be mental health first aid. It's another course that's available should people be interested in learning more about connecting people to resources, and when they might be concerned. I think that during crises and pandemic and different disasters, we definitely see we can see behavioral responses from people when they're pushed to extreme limits that we may not regularly see, and we want to support people to get that help. The National Traumatic Stress Network, they've put together a wonderful parent and caregiver guide about helping families cope with COVID. Of one particular interest on that guide, and the link is in the resource page, is a chart for parents that helps the parents and caregivers. It can kind of help them understand age-wise and developmentally what are some of the responses to stress and anxiety that they might see in the children and youth that they care for.
Thank you. Cassie, would you share a little bit of perspective on the resources that you're familiar with through your organization?
Certainly. And I think there is a slide on this as well. So NCCADV, in recognizing the great financial need of survivors during the pandemic, we have sought funding to be able to provide direct financial assistance. Now, normally NCCADV does not provide direct services except for some direct legal services because we are the statewide coalition. That's generally not what we do, but these are extraordinary times. And so we have done some fundraising through the Night of Safety Fund, where members of the public can donate to support survivor safety. And then we also received a grant from the Governor's Crime Commission, as well as the FIPSA CARES Act. And so those three grants or three funds, we have $250,000 to disperse to survivors who have been adversely impacted by COVID-19. And so our goal with that fund is to increase survivor safety and economic well-being by providing low barrier, no strings financial assistance. And we are able to do this because while the funds from the Governor's Crime Commission and FIPSA CARES Act do have some restrictions on how we can spend that funding, between those plus the Night of Safety Fund, because that is an unrestricted fund, we are able to meet the majority of requests that come in from survivors. So far, we have provided assistance to support survivors' rent, utilities, transportation, telehealth appointments, hotel and temporary lodging, relocation assistance, groceries, mortgage, car repair, COVID-19 protective supplies, phone bills, internet, clothing, and more. So we're really excited to have this fund available. And if folks are interested in learning more, they can head to our website. It's nccadv.org, and folks can find the application for assistance there. They can also donate to the Night of Safety Fund if they're interested.
Wonderful. Thank you for that resource. And this is Jen Richards speaking. I just wanted to talk for a moment about the North Carolina LMEs and MCOs, which many of you may be familiar with, but to say a word about them. The LMEs and MCOs are the local management entities, managed care organizations. And the purpose of the LMEs and MCOs is to deliver mental health, DD, and substance abuse services, primarily using state and federal resources appropriated to them by the state government. These funds are used to authorize, pay for, manage, and monitor services provided by their network of private providers. As of today, there are 8 LMEs MCOs, and they are listed here on this map. Pardon me, 7. And they are listed here on their map. There's a catchment area for each LME MCO. And later on the slides, you will see a link to learn more about the various LME MCOs, their contact information, and resources. And if an individual is seeking mental health, behavioral health, substance abuse, or DD services, they can contact the LME MCO and see about how to establish care with a provider if they do not currently have. Another important state resource currently is the Hope for Healers program, which was set up by DHHS for supporting healthcare workers, their families, childcare workers, and first-line responders. It's a resource that is available as a hotline 24/7 and really is essential for the community to help manage the burnout and stress that healers are experiencing as a result of caring for others during COVID-19. Also, there's the Hope for NC program, which is a crisis services counseling hotline program that's available as well as a resource.
Dr. Richards, hey, this is Bryles. I did get a message that came in privately, a question I would like to go ahead and ask the panelists. It says, what might be top indicators of COVID-driven stresses? And that is from Neil Ober. Thank you.
This is Heather McAllister. Just so I can clarify, so COVID, so stressors we might see, behaviors we might see associated with the stress of COVID. One thing that comes to the top of my mind as a licensed clinical addiction counselor is maybe concerns that people may be utilizing substances to cope in an unhealthy way, which of course could lead to additional issues. Depression, anxiety, those are another two effects that I believe the additional stress of uncertainty, right? We are all facing a lot of uncertainty during these times, and stressors around employment, income, and of course, many people having to juggle many things at the same time we haven't had to, whether it be working from home and having children at home who are in school. And so again, some of the feelings of being out of control.
And this is Jen Richards speaking. As a child psychiatrist, I try to take a developmental perspective when looking for signs of stress. So in a young child, let's say less than 5 years of age, and even into early elementary school age, I may see changes in behavior such as increased tantruming, meltdowns. Sometimes we see regressions in behavior. So if a child has achieved a particular developmental milestone, such as sleeping through the night or toileting, if I see that they begin to lose those skills when they previously mastered them, that's a sign to me that the child may be under stress, potentially related to COVID and its ramifications on the family unit. Other pieces that we notice in children, they may report increased frequencies of nightmares, or the topics that they talk about may change. I think we need to be mindful as caregivers about the media exposure for children. And so if the TV or internet is displaying lots of information about deaths related to COVID, kids can absorb that. And so consequently, you may have kids articulating to their supports concerns about the health and safety and well-being of themselves as well as their loved ones. In terms of adolescence, interestingly, sometimes when adolescents are stressed, we may see, again, experimentation with substance use. We may also see other risk-taking behaviors that may emerge when adolescents are under stress. Similarly, we may see that adolescents articulate more clearly a sense of a foreshortened future or a concern about hopelessness or difficulty envisioning a future for themselves. This may translate into a change in behavior at home or a change in academics. Thank you.
Hi, this is Cynthia Floyd with the Department of Public Instruction. If I could add just a little bit more to what Jen was saying, which I totally agree with. One thing to keep in mind too with younger children, Jen mentioned they're watching the news. Really young children, when they see the same story repeatedly on the news, they often will think it's another story. They don't realize it's a repeat of the same story. I wanted to emphasize what she said about that exposure to the news. And I also wanted to mention, as we think about our own stress, we think about times where people have said, wait till you calm down, don't respond while you're angry, or wait until you've gotten over that stressor. And that's getting down to how our brains basically work. The more stressed out we are, the less we are ready or capable of dealing with the more intentional thought. So we need to keep that in mind as well when we think about what we're asking of children. There still need to be behavioral expectations. But if children are heavily stressed out, they might not be quite as ready to take on as much responsibility, say if it's an academic assignment or a chore at home, still have those expectations. But if you see that they're getting really upset about taking on too much responsibility, it may be that literally their mind is in such a stressed mode that they're not ready to take on a whole lot more at that time. So keep that in mind if you're seeing children get stressed too easily. You might have to break down in smaller chunks the responsibilities that they'll be needing to take on.
Hey, this is Bryles. I just have a quick question. When you said really young, children, can somebody just kind of define for me, like what that means? Is that up to 3, up to age 4, 5, especially with with the piece about TV and media and what they hear, if that's okay.
This is Jen. Kids are remarkable in so many ways, and even in early toddlerhood, 2, 3, they are incorporating information, it's assimilating information, and that continues to go on across the lifespan. And so even kids as young as 2, 3, 4 are taking in information. And so I think it's as early as we can, or as soon as we can, be mindful of what children are being exposed to, the better off.
Yeah. And this is Heather McAllister. One thing I would say, it's not just the age of the child, it's also the developmental level and their ability to understand what's going on around them and take in the information. One behavior that I just wanted to bring up that wasn't mentioned earlier is sleep disturbance. I think that is a particular interest for as our children are going back to school, making sure that their fears and anxieties are not interfering with their sleep, and having the adults around them to support them with addressing that, making sure they're getting enough exercise and other things, and being patient and tolerant with them as they might be experiencing that, and just trying to reinforce regular routines within the family.
And on the slide, we've listed some additional resources for children and families with regard to talking to children about coronavirus and supporting children during this time of potential increased stress.
Hi, this is Cynthia again. I just wanted to emphasize one other thing as well. You see the CDC COVID-19 coping with stress link there. And that is not only for children, that is for adults as well, because we all as adults are also trying to cope with this stress, and we have to be cognizant of our own well-being so that we're even able to adequately take care of children the way they deserve. So be sure to take care of yourselves as well. Self-care is incredibly important through this, and that needs to be on the forefront in addition to taking care of children. It's a critical time for all of us, honestly, to be taking care of one another. So be sure you're also taking care of yourself.
Great point. And Heather, would you also, we've talked a little bit about the importance of paying attention to what's going on with children Can you talk a little bit about the signs of abuse and neglect and how one, if one has concerns, would report this information? And actually, I can open that to any of the panelists.
Heather, if you're sharing, you're still muted.
Thank you. All right. Did
I do
we
it all
have
the
that
time.
prior slide? I'm sorry. I was just chatting away. I don't know what happened to the prior slide. It's okay.
There you go. There's the prior slide.
Perfect. Okay. All right. So yeah, most people, all of us really want the best for our children, and we don't start off with the belief that parents want to abuse or neglect their children. But that happens. It's unfortunate, and one of the reasons why we have child welfare services. But some signs that it's a community. The community really are the eyes and ears, folks who see the children regularly, whether they be school teachers or other caring adults in the community. Some things they might see that is an indicator of possible abuse or neglect, sudden changes in behavioral or school performance. If a child displays some overt sexualized behavior or sexual behavior, knowledge that is inconsistent with their age. A child that has unexplained burns, bites, bruises, broken bones, or black eyes, or bruises or marks in non-prominent fleshy areas of the body. Places that children wouldn't normally have bruises. Often when we fall and children fall, if an elbow or a more prominent area, it's likely to get bruised, but not the fleshy parts, such as inside the biceps or behind their knees. Has fading bruises or other marks noticeable after an absence from school? That's a real challenge right now because the children are not in school regularly. Some are back virtually and others may be doing a hybrid model. I might be concerned, again, wondering, as children are going back to school, hopefully they are all where they need to be. Children who seem frightened of their parents and protest or cry when it's time to go home. And that can be from school or other activities. Or the child reports an injury that has been done by a parent or another adult caretaker. So if you suspect abuse and neglect, it's very, very important, as mentioned by Tracy earlier, to report that to the County Department of Social Services, and to support folks in doing that. There's a link here to the different county departments of social services. There's 100 of them. We have 100 counties, and each county has their own. And again, what I just mentioned is not an exhaustive list around on what you might see, but those are prevalent things. Those are things that you would see. Please visit the Department of Social Services website, and if you're interested in learning more.
Thank you very much. Any last points from our panelists? Any last pieces? I would like to thank you very much. Yes, please.
Sure, this is Heather again. So one thing I neglected to bring up, but I do want to bring up while we have folks on and listening. there are additional ways that adults in the community and families can help. If you are interested in becoming a foster parent, there is a link in the resource section on how to connect with both your local DSSs who train foster parents, as well as private licensing agencies. And I would encourage people, if they're interested, to visit and learn about how to go through that process. It's very important.
Thank you very much. That's an important piece to add. I think a wonderful place to add to stop. I think North Carolina is a wonderful place to live, and I think the community has really come together to support each other, and I hope we continue to do so. Thank you for participating in this webinar discussion. Thank you, panelists. Thank you, VOAD, for giving us a forum to do this, and please share these resources widely. Take care, everyone.
Thank
you, everybody.
Thank you.
This is Briles. Thank you so much, everybody. Thanks, panelists. Thank you, attendees. This has been a wonderful presentation.
We appreciate the opportunity.
Thank you very much.
Thank you all.